The dangers of sedentary work range from back pain to blood clots. More and more people are doing sedentary work today. While it can often be really interesting, long hours of sitting every day are, according to experts, extremely harmful to human health and are associated with a wide range of serious diseases and ailments, from back pain to blood vessel thrombus. Experts say that humans are designed to move, but sitting is one of the worst and most unnatural parts of the human body. Nevertheless, many people today spend a large part of their day sitting. This is due to the increasingly physically passive and sedentary nature of work and the lack of active leisure time. One of the most common complaints in the population today is back pain, and in many cases, it is related to sedentary work. Sitting for long periods of time makes the back muscles tense and fatigued and causes loss of tone, which leads to an irregular posture and a misaligned spine. In addition, abnormalities of the spinal joints and disc herniations can form. According to the doctor, long hours spent sitting also have a negative impact on the internal organs. Sitting puts pressure on the lungs, stomach, and other vital parts of the body, changing their natural position and disrupting blood circulation and function. B2. Sedentary sitting slows blood circulation and increases the risk of thrombus formation in the blood vessels and venous diseases in the legs. Prolonged sitting has also been shown to increase the likelihood of colon, uterine, ovarian, and breast cancers, the development of hemorrhoids, and infertility problems in men. Sitting for long periods of time, a possible cause of depression and insomnia. Paradoxically, sedentary work leads to fatigue faster than moving around, doing physical activity. This is because less blood and oxygen reaches the muscles and tissues that are contracted when not moving. This can lead to drowsiness during the day, a low mood, and insomnia at night. Being immobile and sitting for long periods of time can also lead to depression and other mental illnesses, headaches, and make it harder for the body to cope with stress. According to a specialist at the Center for Medical Diagnostics and Treatment, constant sitting can also lead to cardiovascular disease, diabetes, obesity, cellulite, osteoporosis, and other serious diseases. People who spend most of their time sitting have a significantly lower life expectancy and a higher risk of premature death. The consequences are being felt by younger and younger people. In America, the Health Insurance Department says that people who are covered by health insurance are increasingly spending more on the treatment and diagnosis of diseases and health disorders related to sedentary work. In addition, younger people are also increasingly needing such healthcare services. Health problems due to immobility and prolonged sitting at a computer can occur at a young age. As you know, people are moving less and less today, and therefore they are experiencing health problems earlier. For example, we are seeing that leg vein operations are now being carried out on insured persons in their early 30s, which used to be a rarity. Sometimes, young people are diagnosed at an advanced stage with various diseases related to prolonged daily sitting, which makes it more difficult to cure them. People are also increasingly spending more on health insurance to diagnose and treat spinal and neck disorders, circulatory disorders, venous disorders, and carpal tunnel syndrome, which is caused by prolonged use of a computer mouse. Even when working in an office, it's important to try to move around, as sedentary workers should try to minimize the negative health effects of sedentary work by moving at every opportunity. Sitting at a computer simply means taking regular breaks, resting, and moving around. It is a good idea to sit up, clench your fists, or use a rubber ball, do stretching exercises for your neck, back, leg muscles, buttocks, arms, move your legs, stand up, take a walk. Breaks of 5-10 minutes should be taken every 30-50 minutes or more often. It is also important to exercise every day and to exercise at least 3 times a week. At the same time, doctors point out that it is also important to sit properly at work. Sitting and head posture should be straight and the lower back should be bent slightly inwards. The thighs and shins should form a right angle and the soles of the feet should rest firmly on the floor. When sitting, the shoulders should be lowered and the neck muscles relaxed. If possible, it is a good idea to choose desks that can be used for both sitting and standing work.